This is a successful case using Bisoma Acupuncture for low back pain. This patient is male, age 69, retired. He had an acute episode of low back pain on the right hand side after reaching forward to grab an object, and it froze on him. And he had to be very cautious, careful, because a little bit of movement would aggravate, especially when he was rotating sideways, bending forward as if he's swinging a golf ball. And yes, he loves to play golf, but he wasn't able to for a week, and it bummed him out quite a bit. The first treatment, I gave him LI1, UB66, gallbladder 41, small intestine 5, and stomach 36. Those are all horary points. Those did not help after the first treatment, but his urinary frequency went down a bit from 4 to 5 times a night to 3 times that evening. So I thought maybe these points are good, so I repeated on the second visit, but still no relief in the back pain, and the urinary frequency went back to normal the way it was 4 to 5 times a night. So on the third visit, I gave him the alternate horary points, which are gallbladder 44, wood point, small intestine 2 is a fire point, stomach 43 is an earth point, Li5 is a metal point, and UB40 is a water point. Instead of UB40, I gave him stomach 36 because they do have the same result. After that, he noticed relief. Good. On the fourth visit, I gave him repetition of the alternate horary points, and that gave him additional relief. After the fifth visit, he reported overall 95% improvement. So from the third visit and on, it was a linear improvement in less intensity, less frequency, and shorter in duration. He was able to play 18 rounds of golf with a little bit of aggravation that day, a little bit during the play, and a little bit more that night. But by the next day, he recovered pretty well. So after the sixth treatment, he was pretty much 95% plus better. And so then this is a clear distinguishment of optimal points that he needs for relief. The Li1, UB66, gallbladder 41, small intestine 5, and stomach 36 are the traditional horary points that are helpful for some people with the same condition. But for this patient, gallbladder 44, small intestine 2, stomach 43, Li5, stomach 36 were definitely clearly helpful than the traditional horary points did. But his frequent urination did not reduce. It still remained at around 4 to 5 times a night. And acupuncture in general is not helpful for frequent urination. It is for some people, but I prefer to use constitutional herbal medicine or herbal medicine to help treat his frequent urination, whether it's related to the bladder or to the prostate. For this patient, a regular treatment is important because he's age 69 in his retirement age. Optimizing acupuncture, optimizing his physiology with acupuncture would be good, but it was his personal call to come in as he needed to.